Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. So, webinar about Lyme disease, as you all know, and you create it with your questions. So I'm interested to see what you have in store for me tonight. For those of you that are new here, I'm glad to see some new faces on my participant message board. And for those of you that are coming back again, I'm glad to see you keep getting value and you keep showing up for these. If you happen to see something moving back there, that's Thor, and I've got two Basenjis here, and so sometimes you'll see movement from them behind me. So the way you participate, there's two ways. Number one, you can ask a question, and to do that, you can write your question to me. There's a chat box on the right-hand side down at the bottom of your screen. You can write your question there, okay? The other way you can participate is just listen to what the responses are I give. As many of you know that have participated here before, that usually I use the questions as an opportunity to explain something even in greater detail, okay? So I take that question and expand it and try to turn this into an educational event as well. I am creating a recording of tonight's webinar. If everything goes as planned, I do plan on doing an edit on that tomorrow morning and getting it out to you in the morning. Tomorrow morning, I may get it out a little bit later than typical. It may come out to you by around 9:30 to 10 a.m. due to some other things I have going on this evening and not being able to devote time to it until tomorrow morning. But you will get that. And you'll get an email notification of when I have that ready. So take a look at that in your email. And in that email, you'll be able to click on a link to sign up to next week's webinar as well. Okay? All right. So that takes care of one other thing. So this is our second webinar of this month, and I have another one scheduled for next week as well. And so, yeah, that takes care of it. So my plan tonight is to do an hour and a half with you unless I poop out. Keep in mind, this is a clinical day for me. So I've already been talking to patients quite a bit. So we'll see how I hold up. Usually I'm able to do the whole hour and a half with you, but we'll see how that goes. Okay. So without any further ado, we'll go ahead and get started here. I will, for those of you that are participating in the live version of the webinar, you will be able to read the question on your screen. If you're listening in on the recorded version, I'm going to read the question because these questions don't show up in the recorded version on the screen. Okay? All right. So let's go ahead and get started here. All right. Hello, Dakota. Let's say hi, Dr. Ross. I believe I'm suffering from Bartonella, but my family doctor is skeptical and won't prescribe rifampin or azithromycin. Is it possible to cure Bartonella on my own with your tier 2 approach of houttuynia plus sida acuta plus oregano oil? Thanks. So as many of you know, I have an article about how do you get rid of Bartonella. All right. And I'll show it to you. For those of you that aren't familiar with it, I'll show it to you here in a minute. In there, I describe prescription antibiotic approaches that I call tier 1 approaches. And then I also have a tier 2 approach, which is an herbal option. So the herbal option is working with a combination 3 herbs, actually, sida acuta, houttuynia, and then the oregano oil. Sida acuta, houttuynia, in my experience, work about 70 to 75% of the time. That means 70 to 75% of people will get well using sida acuta and houttuynia in combination with the oregano oil, okay? Now, the oregano oil is something I recently added into that regimen based on research that's been published by Johns Hopkins University that came out, well, actually a number of ones. One that was published in December of this year. There was some ones prior to that. Anyhow, oregano is shown to treat persisting forms of Bartonella as well as to break down Bartonella biofilm and germ biofilms. That's why I use it, okay? So keep in mind, Bartonella is a germ, just like Lyme, that has growing forms and has hibernating, or we call those persister forms. And some of those persisters move into biofilm communities. So you want to treat the growing state and you want to take care of the persister forms in the biofilm. I'm using oregano oil to do that. All right, so in summary, basically you have a 70 to 75% chance that this will take care of your Bartonella. What I usually suggest is trying it at full dose for at least a couple months at full dose And if it is going to work for you, you should start seeing a reduction in some of your Bartonella symptoms by that time. If it is not going to work for you, then it may be time to look at getting some prescription antibiotics and finding somebody that would be willing to do that for you. Okay? All right. Thanks for that question, Dakota, and good luck to you. I'm going to show everyone the article I write about all this too. Let's see here. So let's do a quick screen share here. Oops, I realized I forgot to do something. Hold on, everyone. I forgot to put together the other screen. Hold on here just a minute. Let's see. All right, let me try that again. Oops. I haven't got time of it here. Let me try that one more time. All right. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. I know many of you are aware of this site because this is where you would have signed up for the webinars. Anyhow, I have this very comprehensive guide about how to manage Lyme right here. Click on that tab and you'll see the big mega menu come up here. Take a look in my infection treatment plans section. And in terms of how to kill Bartonella, how to get rid of it, this is the article that I was referring to, okay? So I talk about how to use prescription antibiotic combinations, what these persisters are, and herbal antibiotic combinations in this article. All right. Good luck to you, Dakota. Hello, Ruth. Let's see. I'm in week 5 of DSF. Everyone, DSF is disulfiram. I've worked up to 187 milligrams. I have not experienced a herx or any side effects of any kind. I generally feel better overall, though it's hard to say if that's the anti-inflammatory and dopamine effect or what. My question is, have you had clients on disulfiram just start to feel better and not have any major herxes? Or is that a sign it's not killing whatever it needs to? Prior to disulfiram, I was at about 90% wellness and just hoping to clean up whatever is left. Okay. So, I've treated a lot of people with disulfiram now. And generally, I see that most people at some point, when you get up to a higher level of it, will have some form of a herx reaction. Okay. And so we think that disulfiram causes herxheimer reactions or worsening for a couple reasons. Number one, it kills persisters. Many of you know that. It's the new wonder drug that we're all using to try to treat the persisting form, growth state of Lyme. It probably does not do anything for a growing state of the Lyme germ. But for many people, it seems to be the thing that gets them the rest of the way there. Okay. So it can kill the persister forms or growth state directly, all right? In addition, it probably is a great biofilm buster. Looking at the chemical structure of it and the fact it has what are called disulfide bonds, these are things that can break apart biofilm, exposing germs that hide out in these biofilm slime layers to the immune system and to antibiotics. And so we can have pretty big herxes too, all right? So to date, I have not had anyone not have some kind of a herx on it, but for some patients, that occurs when they get up to their target dose. So a target dose is determined by what you weigh, and we try to have people reach somewhere between 4 to 5 milligrams per kilogram. So if you're trying to figure out how many kilograms you weigh, take your pounds and divide it by 2.2. All right, so a 150-pound person divided by 2.2 is roughly a 72, 73 kilogram person, for instance, okay? And then you would take that number times 4 to 5 milligrams, and that would get you somewhere around 300 milligrams a day or so of the disulfiram, okay? I'm just doing this off the top of my head. I would pull a calculator out and actually calculate it up. So I don't know how big you are, how heavy you are, but 187 seems to be still low for most people, but it all depends on what your weight is, all right? So you want to make sure you're dosing up to that 4 to 5 milligrams per kilogram, and then staying there at that dose for about 3 to 4 months. Now, having said that, even though I'm saying that everyone ultimately, usually at some dose, when you get up high enough, will have some kind of a herx reaction, that's, I probably have treated maybe about 40 or so people now with disulfiram. So, I'm still growing those numbers of people that I'm using it on. I can tell you in treating Lyme disease over the years since treating Lyme beginning in 2004, that there's probably about 5% of people with Lyme that do not get herxheimer reactions when you kill germs. That's what I've seen in my practice. So if you don't get a herx, doesn't mean it's not working. All right. So there you go, Ruth. Good luck to you. Actually, let me just do a quick screen share here. So I think most people are familiar with disulfiram, but for those that are not familiar with this medicine that many of us are using, that is doing a good job for about, it's been a game changer. Take a look at my tab here called The Latest, and take a look at this article called Disulfiram for Lyme Update, okay? And this is where I talk about the latest statistics we have about the fact that 39% of people on disulfiram can get into an extended remission. 50% of people cannot tolerate reaching the target dose. Okay, keep that in mind. And 50% of people get bad fatigue. 30% of people get mental health problems. And 15% of people get neuropathy. All right. I review all of those stats here, and I talk about foods to avoid, how do you start it, etc. It's all in this article. Okay. All right. Good luck. Hello, John. Let's see. Hi, Dr. Ross. My Quest Lab, Lyme, IgG, IgM, Immunoblot, Lyme PCR DNA, Bartonella IgG, IgM, Bartonella DNA PCR were all negative. I lost 60% of my optic nerve in both my eyes. Eye pressure in both eyes is normal. I have pressure in the head, eyes, nasal, and throat, chest. Also have light sensitivity, dizziness, extreme fatigue, and nausea. Any advice? Thank you so much for what you do. So if you're asking, there's a number of ways I could go with this. If you're asking my advice about how to treat this, I don't know. I would need to know more what the cause of all this is, okay? If you're asking my advice about whether this could be Lyme and possible co-infections, the answer is yeah. I mean, it could be Lyme. It could still be Bartonella. If your testing was only done through Quest Lab, Quest uses commercial test kits that have been approved by the Food and Drug Administration to be sold to labs, okay? And they're not the best way to test for Lyme. So for instance, Bartonella and Lyme PCR, well, for a Lyme PCR, which is DNA testing, will only find Lyme when present 30% of the time. The standard FDA approved test kit for doing Lyme testing, the Bartonella IgG and IgM, if done through Quest, will be looking to see if you have Bartonella antibodies against 1 or 2 strains, except we know that there are 15 strains that can affect humans, okay? So if your question is, could this be Lyme and co-infection, the answer is, yeah, it could be, but you need to do better testing. And so the best Lyme test that is out there right now is a test through IGenex. IGenex is a lab in Northern California that specializes in tick-borne testing. They have their own test kit. You have to get their kit, bring it to the lab. The lab will draw it and send it to IGenex. They have developed about 3 years ago now, they developed a test technique which they call their Immunoblot. They also have a Western blot, but their Immunoblot. And what they're doing with their Lyme Immunoblot is they're looking to see if your immune system is making antibodies against 8 kinds of Lyme germs. The standard Quest and FDA-approved test kits only is looking to see if you have antibodies against one strain of Lyme germ. Okay, you can already see there's going to be a bigger chance of finding Lyme if you're using a test that looks to see if you have antibodies against 8 kinds of Lyme. All right. The other thing that that IGenex is doing with their Immunoblot is they're decreasing the chances of getting a false positive test. And specifically what they've done is they've taken proteins from these 8 kinds of Lyme, and they've genetically modified them to remove pieces of those proteins that could give a false positive reaction. So one of the problems in using regular Lyme proteins is, and trying to see if your immune system is reacting, your immune system is making antibodies. And we're trying to see in this test technique if you have antibodies in your blood that attaches to Lyme proteins. One of the problems is these Lyme proteins have amino acid or protein parts that are identical to amino acids and proteins found on certain viruses. So if you get like a human herpes virus type 6 infection or an Epstein-Barr virus infection that has triggered antibodies in you, some of the antibodies against Epstein-Barr and some of the antibodies made against HHV6 may attach to parts of these Lyme proteins. What IGenex has done to fix that problem is they've genetically modified the proteins so that those sequences are removed. So in other words, when you get an Immunoblot test done through IGenex, it will be, when it says it's positive, it really is positive, okay? In terms of validation studies that IGenex has done to see, is their test really good? They've done their own validation studies, and it looks like their test has the ability to find Lyme when present about 95% of the time. So it's fairly accurate. That's better than the FDA approved kit that can only find a Western blot for Lyme that can only find it about 60 to 65% of the time. It's a big difference, okay? All right. In terms of Bartonella, I would also do the Bartonella Western blot through IGenex. So what IGenex has done with their Western blot is they've recreated that too. Their Western blot is looking to see if your immune system is making antibodies. And what they're doing with their Western blot is they're looking to see if you make antibodies against 4 specific strains of Bartonella versus a regular Quest lab is going to be against 1 or 2. Okay, so 4. In addition, what they're doing with their Western blot is they're looking to see if you're making antibodies against the entire Bartonella family. All right. So although they're not set up to determine all 15 specific kinds, they can tell if you have antibodies against the family. So for instance, if you get, you do the Bartonella test, it comes back positive for the family, but it's negative against one of the 4 that they can test for, then it means you have Bartonella of one of the other 11. Okay, so it can give you useful information that way too. Their validation studies suggest that they can find Bartonella if it's in you 95% of the time. That may be a little high actually based on real world experience, but it's a pretty good test, okay? It's still not perfect, but it's a pretty good test, all right? So that's how I would do that. I would contact IGenex, have them send you test kits, circle the Lyme IgM and IgG Immunoblot, and circle the Bartonella Western blot. Do not do any of their other panels. You don't need any of the panels. It's just those tests. Circle them, see if you can get your physician to sign the order form, and then have the lab redraw it and send it off to IGenex. Okay? All right. Thanks, John, for that question. Good luck to you. Hello, Brandy. Let's see. Do you have opinions on the most effective detox options for very bad BART infection with streaking red rashes and psychiatric involvement, heart palpitations, and insomnia? I haven't found anything strong enough to count on during debilitating flares. Thank you. You know, I don't know what's the best way to do this. What I can reflect is when I've got somebody that I'm killing germs, if that's what this is from, and their BART symptoms flare, I often will give IV glutathione, and that can sometimes turn things around. What the glutathione does is glutathione is a very powerful antioxidant that's made in every one of our cells. Its purpose is to fix cell damage, okay? But the other thing it does in an acute situation is, as a very powerful oxidizing agent, it sends signals to your white blood cells to tell them to stop overproducing cytokines. And it's inflammation cytokines produced by the immune system when it sees Bartonella or when it sees dead germs, if you're killing germs, that trigger all of your flare. It's the cytokines, okay? The other thing that IV glutathione can do, in addition to lowering cytokines and fixing cell damage, is it is very useful at lowering toxins, helping the liver remove toxins that can be triggering some of the flare as well too. All right. So IV glutathione is one way to do it. If you can't get IV glutathione, sometimes using nebulized glutathione. And if you can't do that, also doing oral glutathione, if it's a liposomal variety, can be helpful too. Liposomal means it's glutathione microscopically wrapped in fat. The product I like for that is made by a company called Research Nutritionals. They've got good data showing good absorption of their product and an elevation of red blood cell levels. At least that's what they studied of glutathione when you take their product. So it does get absorbed, does get into you, okay? So your most affordable option would be liposomal glutathione by Research Nutritionals. Their product is called Trifortify. I would do a teaspoonful once or twice a day during a flare, or you could use nebulized glutathione. You have to have that made by a compounding pharmacy. I usually have people take it as 200 milligrams per milliliter, and you do 2 milliliters in a nebulizer machine twice a day. Or the best way, the strongest way, would be intravenous glutathione, anywhere from 1,200 to 2,500 milligrams through an IV, and that you can do once or twice a week, actually, okay? Let me show you my article on glutathione so you have the information in front of you to look at, okay? Let me just do a quick screen share here. All right, so I'm just going to type in glutathione. So my article is called Glutathione, the Great Fixer. Take a look here. I describe all the things that it can do. And then down here at the bottom, I talk about the ways that you can get it, okay? All right, including the oral form. And down here, I talk about the nebulizer form and the IV form. Excuse me, everyone. Nothing like a good sneeze to wake you up. Anyhow, a nebulizer, everyone. I think many of you know what a nebulizer is, but for those of you that don't, basically it's an air compressor. It's about this big. It has a small tube that comes out of it. That tube connects into a chamber, a plastic chamber that holds liquid. You pour your glutathione liquid into this chamber. It has a top that screws on it with a mouthpiece that comes out. And basically, as the air from this tube blows over the chamber, it turns the glutathione into a mist that you can breathe in. And when you breathe it in, it gets absorbed through the blood vessels in your lungs, deep into your bloodstream. So it can sometimes be as powerful as doing glutathione IV, actually. Okay? All right. Thanks for that question, Brandy. Good luck to you. Hello, Kathleen. Let's see. Hello, Dr. Ross. Thank you for taking time to answer our questions. You're welcome. My question is, my doctor prescribed olive leaf extract and L-lysine to treat my co-infections of EVB, mycoplasma, and HHV6. I started taking these supplements on Sunday. On Tuesday, I developed pins and needles all days in my legs and feet and face. I took the supplements Tuesday night, not connecting the supplements with how I was feeling. Yesterday, I had painful pins and needles again in feet, legs, and face. And then I thought perhaps my symptoms might be connected to one or both of the new supplements. Does this sound like a herx reaction or maybe an allergy? My doctor said I should discontinue until the symptoms subside, which I did. And my symptoms are milder today. Thanks. Your thoughts. All right. So When you have a reaction to germ killers like olive leaf extract and even L-lysine is not necessarily going to be a germ killer. It's more of an immune system modifier, okay? But when you have a reaction to medicines that can be involved in resulting in death of germs, you can get herxheimer reactions. But the other thing you can get are side effects, all right? So typically a herxheimer reaction is going to, when you get a herx, what happens is the immune system sees dead bug parts and it reacts by making more of those inflammation chemicals called cytokines that I think I mentioned earlier tonight, okay? So cytokines are made by white blood cells whenever they see an infection or a mold toxin or yeast in you, and their purpose is to turn the immune system on. So certain white blood cells will see a germ or a toxin, they'll manufacture cytokines. Those cytokines then are supposed to, on the good side, they turn the immune system on, they help it work better, they draw the white blood cells to where the infection is, all right? But in situations where the immune system doesn't do a good job, it tries harder and harder, and eventually it makes too many cytokines. And too many cytokines are what happen when you have Lyme, or when you have mold toxins, or when you have yeast in you, all right? And too many cytokines also get made by the immune system when it sees dead bug parts from killing these germs, all right? So cytokines in excess give you fatigue, make you hurt all over, can sometimes give you confusion, can disturb your sleep, okay? Those are the common symptoms we see in a herxheimer reaction. Typically, and if you had underlying neuropathy already, then sometimes that will get worse too. So what a herx is a surge of cytokines. And because those cytokines give you most of your underlying Lyme symptoms, what you usually will see is a worsening of your underlying Lyme symptoms. If what you're having here, this kind of pins and needles sensation, is nothing you had before, then that probably isn't a herx reaction. It probably is a side effect of one of the medications that you're taking, one of these herbal supplements. Which one it is, I don't know. I would call it a typical side effect. And the way I would do this is I'd have you stop both of them, like your physician is doing, and then I'd have you restart one, see what happens, see if that's the culprit. If it's not, then I would add in the other one and see if that's the culprit, okay? That's sometimes how you got to do it. I don't think this sounds like an allergic reaction to me, okay? All right. Good luck to you, Kathleen. Thanks for the question. Hello, Julia. Let's see. I'm on day 76 of a mystery illness. I suspect maybe Lyme with wide-ranging symptoms from tremors and palpitations to brain fog and fatigue. I have improved significantly over this time doing your protocol. Just started Otoba and cat's claw this week, along with hyperbarics, acupuncture, paleo GAPS diet, and ozone therapy. My ELISA test was just under equivocal, so it didn't go to Western blot. After this much time and improvement, though, I'm far from normal. Would an IGenex be reliable? Or do I need to just rely on a clinical diagnosis even though my doctor isn't Lyme literate? We have done extensive testing to rule out other conditions, i.e. MRI, CT, EEG, EKG, and blood work. I so appreciate your help and generosity, Dr. Ross. All right. So as I mentioned earlier, well, actually, I didn't talk about the ELISA. So the ELISA test that can be done, let me step back for a minute. The standard way that most doctors test for Lyme is they follow the recommendations of the Centers for Disease Control and the Infectious Disease Society of America, which says to do a two-step test. Step one is to get something called an ELISA for Lyme. And if it's positive, then you do the Western blot test, all right? So an ELISA, what that is it's a way of seeing, it's a technique we use to see of all of the antibodies that your immune system has ever made to attack a germ. Could some of those antibodies be made against Lyme? It's a good test, okay? And if you have antibodies in you that could be made against Lyme, in other words, if your ELISA comes back positive, then we're supposed to do a test that confirms if they really are made against Lyme. That's the Western blot, okay? That's kind of the breakdown on that. So the trouble is with the ELISA test is it will miss Lyme when you have it chronically about 50% of the time. All right. So what I would suggest here is that you look at doing the IGenex Immunoblot that I mentioned earlier, because it can find Lyme when present 95% of the time. The reason I suggest doing that is if you're going to try to keep your doctor on board to help keep treating this, you're going to want to give him some proof, or her some proof, okay? And the other thing is when treatment gets difficult, as it can in Lyme, it's easier to keep going forward with your treatment if you have a positive test. Now, taking the things you've taken here will not alter the results of your Western blot. In fact, being on germ killers like an Atoba and cat's claw may actually give you a greater chance of getting a positive immunoblot. Okay, so I want to be clear. If you get that test kit from IGenex, they offer both a Western blot and an immunoblot. You want to get the immunoblot. Okay, the immunoblot is their fancier new way of doing this that they came up with a few years ago. That's the one that tests against 8 strains of the Lyme germ. As I mentioned earlier, that's the test you want to get done. Okay. Let me do a quick screen share here so you can take a look at that in greater detail so you make sure you get the right test number and all that. So let me do that here real quick. Okay, so I have a whole article that is a discussion of testing for Lyme. You'll find it in the test section of my Lyme guide, okay? And take a look at it here. It's a review of Lyme infection tests, pass or fail. I review why the ELISA is bad, etc. But you're going to want to take a look at the newer immunoblot, this section here, using synthetic proteins from IGenex, okay? And I tell you in here, I believe I even gave the test numbers in here. I hope I did. Immunoblot, okay? All right. I thought I had put the test number in here, but it looks like I did not do that. Oh, maybe I did down here. Hold on a minute. Oh, here we are. Okay, yeah, I did. So in the bottom of this article, I have the test numbers listed, okay? So the test numbers are 325 and 335. Those are the ones you want to get. That is the Lyme immunoblot through IGenex, okay? All right. Good luck to you, Julia. Let's see here. Hello, Bill. Let's see. Hello, Dr. Ross. Just started amphoterecin B for resistant yeast infection. After a week, the bloating and gas has gotten a little worse. Do you find this in some of your patients? Also, can you monitor arabinose levels to assess efficacy? Thank you. So arabinose, everyone, is an organic acid that you can get through a urine organic acid test. Arabinose is one of the indicators I find somewhat reliable for seeing if you have yeast in your intestines. Usually I make a decision if you have yeast based on clinical symptoms, but sometimes when it's not clear to me, I will get this organic acid test that includes an arabinose. And if arabinose is elevated, it can indicate that you have too many yeast in your intestines, okay? So, Bill, yeah, you could follow the arabinose, but I probably would not check it until you've actually been treating for at least a month. Sometimes when you start killing yeast with the amphoterecin, and I think many of you may know, I've talked about amphoterecin here before, but when it comes to killing too many yeast in your intestines, sometimes the standard ways that we do it with like an nystatin or herbal remedies or itraconazole or fluconazole, those options that we have that are pretty straightforward to treat intestinal yeast sometimes will learn resistance against them. And so my go-to approach when yeast are still in the intestines, but standard treatments are not working, is to use amphoterecin. I find that this drug works about 95% of the time to get somebody well, but it will take about 2 months. Now, amphoterecin has to be mixed up by compounding pharmacy. And the reason it has to be mixed up by compounding pharmacy is it's only manufactured for intravenous administration. but we want it to be given in an oral form. In an oral form, it's not absorbed out of the intestines at all. So it just sits there in the intestines, killing your yeast. And that's great. That's what we want it to do, okay? If some of you start reading about amphoterecin B, you're going to see horrible things about it because in an IV form, it's very toxic to the liver. But in an oral form, it is not, because it's not absorbed into the bloodstream, okay? So it's very safe to use in an oral form. If you're going to use it to kill yeast orally, it's 200 milligrams 3 times a day is what I will use. And Bill, sometimes as we start using it to kill yeast, killing yeast can trigger more gassiness and bloating. So I probably keep going forward at this point. If you're finding that the increased gassiness is really uncomfortable, you might consider cutting the dose back from the 3 times a day to twice a day to see if it's more tolerable for you. And as you lower some of that yeast load and the gassiness gets better, then try to go up on it again, okay? Those are some things I sometimes will wind up doing, okay? All right, good luck to you, Bill. Thanks for the question. Oh, let me just do a quick screen share here so you all can read about the ways that I approach yeast, including using that amphoterecin. All right, so again, let's see here. So as you know, we're reading from my online Lyme guide. Take a look at the section I've written on yeast. And if you're interested in seeing if you do have too many yeast and why it's a problem to have too many yeast, take a look at this article here. That's too many yeast living in your intestines, okay? But if you're looking at how do you get rid of too many yeast, in this article, I review the various ways that you can try to remove too many yeast. And one of those involves using the amphoterecin B that I outline right here for you, okay? All right. Good luck, Bill. Hello, GK. Let's see. Help, please. After using a Rife machine one time for Lyme and co-infections, I am having tremors and vibrating that feels like my nervous system is overstimulating. It also brought on joint and muscle pain, making it hard to walk. What can I do to calm down my overstimulated nervous system down and help relieve this inflammatory response? Knees are particularly achy. Thank you. All right. So GK and everyone, so Rife machines, GK, you probably know, but I think most of you may know this, but Rife machines are machines that generate electromagnetic frequency waves. And in theory, we should be able to find electromagnetic frequencies that vibrate with the covering of a germ to burst it. And that's how they kill germs. So it's kind of like if you have an opera singer and they sing in front of a glass of water, they can find a way to sing, a tone, a frequency to sing at that vibrates that glass and breaks it. It's the same idea with how Rife, in theory, can kill germs, okay? Now, part of the problem is those electromagnetic frequencies may irritate your nerves. So that could be one of the things happening here. But the other thing that may be happening here is you may have had a Herxheimer reaction from killing germs, all right? So again, if you kill germs, that can trigger the immune system to overproduce cytokines. Those cytokines can give you fatigue, joint pain, and killing those germs may have also released toxins that then become neurologic irritants, which may be why you're vibrating and feeling that way too. So in an acute situation like this, there's a couple of things you can do. And these are things I would have people do to manage Herxheimer reactions in general. Number one, I like working with liposomal curcumin. It's curcumin, which is a component of the Indian seasoning turmeric. Curcumin gets inside white blood cells and decreases cytokine production, all right? The product I like is made by a company called Thorne. It's Mariva 500. It's a liposomal variety of curcumin. It's a 500 milligram pill. In extreme situations like this, I would do 2 pills 3 times a day. So 1,000 milligrams 3 times a day. The other thing that's very helpful in an acute situation like this is to do either IV glutathione, and I had mentioned that earlier tonight, or get liposomal glutathione as a product called Trifortify Orange or Trifortify Watermelon, made by Research Nutritionals. And for that, in a situation like this, I would do 5 milliliters, which is 1 teaspoonful twice a day. Okay, those are some thoughts for you. I'm good luck with you. Okay, all right. Excuse me, everyone. Hello, Joyce again. Let's see. Hi, Dr. Ross. Another question. I have had Lyme for almost 20 years, and over the past couple of years, I have been having increasing weakness in my shoulders and arms. No matter what I do, I live a very healthy lifestyle. I can't seem to turn this around. I'm getting very down about this as it is affecting many aspects of my life. Have you seen this in chronic Lyme? Do you have any ideas of why this is happening, what I can do? Sometimes I see questions on your webinar that I have dealt with that you are not familiar with, understandably. Is there any way we could start a group where we could share experiences? Thank you. Hi, Dr. Ross. Another question. I've had Lyme for almost 20 years. Oh, you wrote it twice. Okay, let's see. So, So in terms of just second part of that, my time is spread very thin. By the time I have a clinical practice, try to keep up to date and write new articles for my Lyme information site and host these webinars, I don't have time to actually help with having another forum. So unfortunately, I am sure, through Facebook, you could set up a page and see if there's people that would want to join you, but I just don't have the ability to do that right now or the time to do that. Okay. But in terms of this kind of problem that you're having, so weakness in the shoulders and arms could be from a couple things. Number one, it may be that you've got some neurologic injury that is triggered by Lyme and maybe even Bartonella that's triggering the nerves not to fire correctly and causing weakness in the shoulders and the arms. Okay. Second thing is you may have injury that has occurred to the energy factories found in your nerves and your muscles called mitochondria. So every one of our cells has its energy factory system. They're called mitochondria. There's about 300 to 400 of them in a cell. And inside of mitochondria is where sugar and fat are burned through a bunch of chemical reactions and create cell fuel, something called ATP. When you have chronic infection like Lyme, or you have chronic mold toxicity, the immune system responds and overproduces oxidizing agents. Those oxidizing agents can injure the covering of the mitochondria. And if the covering of the mitochondria, which is a double layer of fat, gets injured, it results in poor energy generation inside the mitochondria. Okay? All right. Now, keep in mind, if you have injured mitochondria, that means your muscles don't have enough energy to run. It also means your nerves don't have enough energy to run to correctly signal the muscles to work. Okay? So you could try to repair your mitochondria to see if it might give you some benefit here. And there's a few things I would suggest for you. Number one, remember I said it's the mitochondria membrane, that double layer of fat that gets injured. So you want to repair that. And when we repair the mitochondria membrane that way, it's called phospholipid repair. Those are the kinds of fats that make up the mitochondria. And so the phospholipid, what I like to do for that is there's 3 different products that are manufactured by Research Nutritionals. One of those phospholipid repair products is something called ATP 360. There's another one called ATP Fuel and one called NT Factor. I primarily these days focus on either using ATP 360 or NT Factor. The ATP 360 has coenzyme Q10 in it. The NT Factor does not have coenzyme Q10 in it, in addition to the fats I was talking about. So NT factor is something you can use if you're treating your babesia, with mepron, malarone, or atovaquone. Because if you're treating babesia using mepron, atovaquone, or malarone, you can't be on CoQ10. It interferes with it, okay? But if you're not treating babesia, then you want to use the ATP 360. The way I have people do that is 3 pills 1 time a day. It will repair the fat membrane, and it has in it nutrients that help your mitochondria work better, like the CoQ10, okay? All right. The NT factor, if you cannot be on CoQ10 because you're using something to treat babesia, the NT factor, the way you dose that is 2 pills 3 times a day, okay? So ATP 360, 3 pills 1 time a day, NT factor, 2 pills 3 times a day. In addition, I would also suggest being on glutathione. Glutathione is a very strong antioxidant that gets inside mitochondria to fix injury from the inside. Think of the phospholipid repair with ATP 360 or NT factor is fixing from the outside. Glutathione gets on the inside and does a repair job, okay? And so I would do the Trifortify product that I mentioned a number of times tonight because it's got good lab evidence showing it's got good absorption and will raise levels of your cells of glutathione. And I would do that Trifortify product as 1 teaspoon 1 time a day. I would give all of that a minimum of 2 months to see if it makes a difference and starts to help. If you are getting benefit from doing that, then I would continue it 4 more months for a total of 6 months. That seems to be about the length of time it takes to get maximum mitochondria repair. Okay. All right. So I'm gonna show you 2 articles to take a look at here. All right. So in terms of mitochondria and mitochondria repair, take a look at my section on energy. I think I got something here. Energy and fatigue. Okay. And there's a whole article I have here about how to fix mitochondria and get energy and Lyme disease. In here, you'll see I also mentioned CoQ10 is something to use. And also, if you are a vegetarian, I mentioned that you should also take another chemical called carnitine, but you can read those all about in here. All right. In terms of these different products and the different products that Research Nutritionals makes called ATP Fuel, ATP 360, and NT Factor, and what the big differences is between them, take a look at this article here where I compare the 3 different products. Okay. All right. Thanks for the question, Joyce, and good luck to you. Hello, Geraldine. Why do symptoms of candida overgrowth resemble the same types of symptoms Lyme may give, similar to fibromyalgia? Is it common to have candida problems after treatment with antibiotics for a long period of time? So the answer to your last part of the question is yes, it is, okay? So the relationship, and I mentioned it earlier tonight, but I'll mention it again here specifically in response to your question, is the key to understanding why mold toxin illness, Lyme disease, chronic virus infections, and yeast all can look the same is that they all trigger the immune system to make too many cytokines. Remember, we talked about cytokines earlier tonight. Cytokines are manufactured by white blood cells when they see a foreigner in you, okay? A foreigner like germs that aren't supposed to be there, like yeast or viruses or Lyme, okay? Or a foreigner like a mold toxin, all right? And they make these cytokines to basically turn on the fighting part of the immune system to deal with these. Also, those increased cytokines cause more white blood cells to be made, and they help draw those white blood cells to where the problem is. All right, that's all good. But in all of these situations, sometimes the immune system doesn't do a good job, and it overproduces cytokines. All right. So to kind of put it in context, I had a patient one time that saw me that came in with a history of a tick bite, very positive Lyme testing, symptoms that are very suggestive of having Lyme, of fatigue, insomnia, cognitive brain dysfunction, you name it. I mean, she had the whole picture that looked like Lyme, but she just looked, I could tell by looking at her that there probably was yeast. And the reason that tipped me off to even go, well, I always go there with everyone, but the thing that really stood out for her is that she had this just horrible acne problem that would not go away. So I asked her a lot of questions about yeast. And so she had just symptoms that suggested raging yeast. I mean, she had marked sugar cravings, gassiness and bloating, periodic vaginal yeast infections, and then she had the acne and the pimples. Okay, now the relationship with acne and pimples and yeast is when you have too many yeast in your intestines, not only do they trigger the immune system to overproduce cytokines, these yeast release toxins. And those toxins can be neurotoxic, but those toxins also can interact with your skin, making it easier to get pimples and acne. And often when somebody's got too many yeast in their intestines, and if you clean the yeast out there, their acne is going to go away. Okay. So anyhow, I looked at her and I thought, I decided because of how much yeast it seemed that she had clinically that I decided not to do anything for Lyme on her first visit, but rather just focused on yeast. By the time she came to see me 1 month later, all of her symptoms were gone. Everything. All right, everything. Anything that even could have remotely looked like Lyme, because in her, what was triggering her cytokines probably wasn't even Lyme. Maybe her immune system had already dealt with Lyme. What was triggering her cytokines was yeast. And I have a number of stories. I can tell you countless stories, similar stories to that, okay? So likewise, on the other side of treating Lyme, if you've treated Lyme for a long time and you're not getting better, sometimes it could be because you got too many yeast sitting in your intestines triggering cytokines. Also, in my practice, I find that when somebody has gotten better, maybe they're in remission or they're doing better, maybe not all the way well, but they've had significant improvements, and then suddenly they get worse, 80 to 90% of the time, I find in my practice, 80 to 90% of those declines are due to too many yeast moving into the intestines, triggering cytokines, okay? So often if I've got a major decline in my practice with somebody that's treating Lyme, I'm going to think to go after yeast, clean those out, and often that will turn things around, okay? All right. Geraldine, thanks for that question. Hello, Damien. Let's see. Hi, Dr. Ross. Do you find people with chronic Lyme require some amount of antiviral support during their treatment? What herbs do you recommend? So I know there's a lot of my colleagues that go down the whole rabbit hole of treating chronic viruses. I don't. And let me explain why. So it's very common for healthy people, not people with Lyme, but healthy people, to have evidence of chronic viruses in them. So if we were to pull 100 people, 1,000 people off the street, and we were to do, let's say 1,000 for the sake of this discussion, and if I were to do testing to see if these people have virus antibodies, elevated antibodies against viruses, I would find elevated antibodies against viruses in about 20% of these healthy people. Okay, you heard it. Healthy people can have elevated antibodies against viruses, all right? So the thing is about these viruses, which are Epstein-Barr virus, parvovirus B19, human herpes virus type 6, human herpes virus type 8, cytomegalovirus, other viruses, is that there's a lot of these viruses that chronically cohabitate in healthy people. They can live in us the same way that we have bacteria living on our skin, bacteria living in our intestines. We can cohabitate with germs, all right? And they don't cause us a problem. So, and having elevated antibodies just says your immune system is working and doing what it's supposed to do, which is keep them under control. Having elevated antibodies does not tell you, did the germs get out of control? All right. And so it's very common in healthy people to have elevated antibodies against viruses. So why do we think it would be any different in people that have Lyme? And just having elevated antibodies against these viruses doesn't prove they're part of the problem. It just means your immune system is working to keep them under control. Having elevated antibodies does not prove these viruses are out of control, all right? So because I know that in healthy people, this is background noise to have elevated antibodies against viruses, I also know that can be true in Lyme. My approach with these viruses is I don't test for them because I know that they're going to be elevated even in healthy people, okay? But if I'm about 6 months, well, let's say 9 months to a year into a treatment, and I've addressed co-infections, and I've dealt with mold toxin illness, and I've fixed mitochondria, and I've done a whole host of other things to get a person well, and we're still stuck, then I'm going to start wondering, did the viruses get activated? Okay. And it's at that point that I usually will start looking for them and consider treating. Now, in my approach to looking at chronic viruses, because again, I don't trust the antibody testing because it can just mean your immune system is working great and keeping them under control. What I will do to see if viruses are out of control is I like to measure an enzyme called nagalase. And nagalase is an enzyme made by viruses, and it's supposed to basically, it's used to deactivate, remove a sugar group from a chemical called GCMAF, which stands for mast cell activation factor. Mast cells are a type of immune cell that fight virus infections, and viruses like to deactivate them, all right? So you can tell if you have increased viral load in your body by seeing if there's increased nagalase. It's a way of measuring to see if there truly is increased viral load. So if I'm going to try to see if somebody has increased viruses, I'm going to measure a nagalase level to see, do they really have evidence of elevated virus load, not whether the immune system is trying to deal with them or not, okay? One other factor to consider. If you have chronic viruses living in you, and as a result of Lyme, you get immune suppression that decreases the immune ability to keep these viruses under control. In that kind of a situation, treating Lyme, lowering cytokines, getting your adrenal glands to work, all those things that I recommend to manage Lyme will ultimately turn the immune system on so it will deal with the viruses themselves too, all right? So my approach to chronic viruses is don't check for them. Even if they're there, the antibodies are there, it doesn't prove they're overactive. And if they are overactive, the best thing you can do is get the immune system working right by getting Lyme under control, lowering cytokines, supporting your adrenal gland and your thyroid. All those things that I recommend as part of the Ross Lyme support protocol, those are the things that are going to get your immune system working better to get your viruses under control if they are a problem. Okay? All right. Damien, thanks for that question. Let me do a quick screen share. Let me do a quick screen share here just a minute. All right, so in terms of the nagalase, if you want to read more about it and my arguments for why you don't necessarily treat elevated antibody levels, take a look at about this article called How and When and How to Treat Chronic Viruses in Lyme, a brief guide, okay? I walk you through all those arguments as well, okay? All right, now, Damien, one other thing. If in fact you do, let's say you're 9 months into treatment, you're not getting better, you've done all this good stuff to manage Lyme and co-infections and yeast and mold, and you're still not doing well, then the things I like to work with, if I've determined I really think that somebody does have a virus problem, I like to do a few things. Number one, I like to work with a transfer factor, two transfer factor products. One is called transfer factor multi-immune, which turns on a group of immune cells called natural killer cells to fight viruses. Number two, and that kind of is a general turn on, okay? Number two, I like to use a product named by research nutritionals called transfer factor plasmic that has in it transfer factors that target the immune system to fight. I think there's 8 virus infections that it's designed to target, okay? And that's transfer factor plasmic, PLASMYC. I mentioned it in that article, 1 pill twice a day, okay? And then the other thing I like to do to boost the immune system is I like working with reishi mushrooms. 400 milligrams 3 times a day has been shown to turn on the cells that fight viruses as well too. Okay. All right. Good luck to you, Damien. Hello, Joanne. Let's see. What are your thoughts on the following for detoxification process? Daily coffee enema, Epsom salt bath daily, lymph massage weekly, colonic cleanse weekly. This is all in the name of detoxification during Lyme, tick-borne relapsing fever, Bartonella treatment. My son is getting IV glutathione once a week, but his brain fog still has not cleared. As another note, his cytokine panel shows interleukin-1 beta high at 14.6, tissue necrosis factor alpha high at 7.8. He also does not have yeast. Does this tell you anything? Thanks for doing these webinars. Really about your insights. Thank you, Joanne. So first of all, I want to talk about terms. So I know that a lot of people, quote unquote, feel toxic. I feel toxic. I hear that daily in my practice, okay? And I know many of you feel toxic. And I hope you hear the word I'm saying, feel toxic, okay? Feeling toxic does not necessarily mean you have too many toxins in you. All right, so what makes you feel like crap, actually? Is it toxins or is it cytokines? And it's cytokines, actually. So when people feel toxic, what really probably is going on is they're overproducing cytokines. So I like to target my treatments in that direction, okay? And so what I like to do is do some things to lower toxins that could be triggering cytokines. And I like doing IV glutathione or oral glutathione. So you're already doing that. But the other things that I would wind up doing is get him on some anti-cytokine herbs like curcumin, or you could, so that Thorn Mariva 500 product that I've talked about earlier tonight, it's a 500 milligram pill, and you'd want to do, top dose would be 2 pills 3 times a day, okay? The other thing I would wind up doing is couple that with some glutathione. If you don't have success using the curcumin product, then you might want to look at a combination product that has a number of things in it that lower cytokines. And that's a product called Cytoquel, that's Cytoquel by Research Nutritionals. And Cytoquel has a variety of things in it that lower cytokines, including resveratrol, curcumin, quercetin, I believe black tea, but it's got a variety of things in it that all collectively lower cytokines, and you could take up to 2 pills 3 times a day of that too, okay? Then if, and so those are the things I would do. I think that we give, in general, a lot of people give too much weight to this idea of detoxing, and the true problem probably isn't a buildup of toxins, it's more of a buildup of the cytokines, all right? So all these other things you're suggesting here, I really don't find much benefit from them, to be quite honest, okay? All right. So let me do a quick screen share here because I've mentioned a number of things tonight. I just want to show you something. Well, let me go back here. All right. Okay, so I've mentioned a number of supplement products tonight, and I know some of you may be wondering where can you get them. So if you are interested in figuring out where you get your Trifortify, or where you can get Cytoquel from, or what's in Cytoquel, this is my supplement store. These are the where I sell supplements to anyone that wants them, including my existing patients. So this is where my patients come to get their products. I've hand-picked products here that I find to be effective, that are shown by the manufacturers to truly have the ingredients in them that they say are in them. And the reason I raise that point is there have been a number of independent studies of products found at Costco. I believe Target was in one of these studies that show us that a lot of these manufacturers are not putting their active ingredients in that they have on the label. In fact, there's New York Attorney General a number of years ago did some DNA studies where they looked to see where the material is actually in based on a DNA fingerprint. And a lot of these products that are sold by a lot of manufacturers don't have in them what they say are in them, okay? So I've tried to take that guesswork out of it for you here. If you're going to use supplements, make sure you're using products that have some track record of having what's supposed to be in them. The brands I choose here do. Secondly, you want to work with brands that are not using the lowest cost ingredient, but are rather focused on finding the ingredients that have the highest chance of helping you, or quality ingredients. That's what these products do here too, okay? So for instance, the Cytoquel, if you're looking for it, just use the search bar up here. And in terms, remember I said I'm trying to remember what's in this. So Cytoquel has in it, looks like so it's got black tea extract, N-acetylcysteine, curcumin is curcumin. It's got some tocotrienols, and it does have the resveratrol that I was talking with you about earlier, okay? I also thought it had quercetin in it, but I guess it does not. Anyhow, there you go. All right. So anyone, you can buy from there, okay? All right. Joanne, thanks for that question. Good luck to your son. Hello, Jen. Hi, Dr. Ross. When retreating with disulfiram, would you select tinidazole, grapefruit seed extract, or something else to address the cyst form of the spirochete? Can you also tell us thoughts about the published Dapstone study about a month ago? Thank you. Okay. So Jen's asking about two things. So first of all, as I've said before, disulfiram, or I mentioned this last week, but I'll mention it again. So according to data, based on a chart review by Dr. Ken Ligner, who's the doctor that first started using disulfiram in his practice to treat people with persisting Lyme. His studies show that around 39% of people that use disulfiram can get into remission, okay? And he calls extended remission something where they don't need antibiotics for at least 6 months or more. His experience corresponds with my experience, okay? So that means 39% of people can get into extended remission, which means that 61% of people don't. Okay, all right. In addition, when you treat with disulfiram, we try to get people, we work up slowly until you get to a target range and you're there for at least 3 to 4 months, okay? So if you don't get all the way well on disulfiram, you wonder what the next step is, all right? So one of the things you can try, so keep in mind with disulfiram, that we know from research published by Stanford that it is useful at treating the non-growing state of Bartonella, which are called persisters. The trouble with the Stanford University studies is they didn't look to see, does it treat the growing forms of the germ, okay? So again, we can have growing and persisters. Persisters think of as being hibernators, okay? And in the world of Lyme, we know that there are forms of the germs, which are called spirochetes. Those are the corkscrew-looking things you probably have seen pictures of before. And there are microscopic cyst forms. So there's forms and there's growth states, okay? So spirochetes can be growing, or they can be in a hibernating or persister form. Cyst can be growing, or they can be in a hibernating persister form, all right? So when you use disulfiram by itself, one of the reasons that people may not get better, that are in the 61% that don't get better with it or don't get into remission, it may be that the disulfiram didn't do enough for their growing forms. And so on retreatment, I am putting people on disulfiram, and I'm using antibiotics that would treat both their growing spirochete and their growing cyst. So to answer your question about the cyst, what could you use to treat the cyst form? Tinidazole or grapefruit seed extract. You could either one. However, if you're going to do disulfiram, I'd probably use the grapefruit seed extract. And the reason is disulfiram can lead to liver inflammation. Tinidazole can definitely lead to liver inflammation. It might be too much for your liver to handle. Grapefruit seed extract, on the other hand, is very effective against treating cyst forms of Lyme, but I don't find it to lead to liver inflammation. Okay, so in this kind of situation, I'd probably do the grapefruit seed extract with that, okay? For those of you that are wondering, well, what can I use for my spirochete? take a look at my article, my Lyme disease antibiotic guide, where I walk you through the various antibiotics you can use to treat spirochetes. Generally, what those are, they're either going to be, my preference would either be macrolides like azithromycin, clarithromycin, or tetracyclines like doxycycline or minocycline. Okay? All right. All right. The second part of your question. Many of you are familiar with Dr. Horowitz. Horowitz is a Lyme literate medical doctor that has published books and is doing some research out of his practice as well, too. And so Dr. Horowitz, in terms of an approach to treat persister Lyme, for a number of years has been writing about and advocating the use of a drug that we use to treat leprosy, which is called dapsone, and coupling it with other antibiotics. In his latest study, he looked at he described the experience of 40 people in his practice that he treated with a combination of doxycycline, rifampin, and dapsone, but at very high doses of dapsone. He worked them up to 100 milligrams twice a day of dapsone. Okay. Now, what do I think about that? I think if you can tolerate it, it might work for you. What his study showed of those 40 people, it was a retrospective chart review of 40 people that were able to take it for at least 2 months. Okay, so I want you to hear the words I just said. It is a chart review that was done after people had completed therapy. And these were people that showed that they could stay on it for 2 months. And that's the big problem. It's hard to stay on dapsone. I'll come back to that here in a minute, okay? All right, now of these 40 people in his practice, he claims, his data shows on his retrospective chart review, is that 40% were able to get into 45% were able to get into extended remission. All right. Now, again, Liegner's data on disulfiram says that 39.5% of them get into extended remission. Horowitz's data on these 40 people said that by using it for problems, there's even problems with Liegner's study too. So first of all, 40 people is a small population. Secondly, this is a retrospective chart review where you look back at the medical record. And so these were not blinded studies, these were retrospective. And Horowitz is a good guy, don't get me wrong. I think Horowitz is doing some great work, but he's a big promoter of his work. And as he does his chart reviews, his opinion and what he wants the outcome to be is going to influence ultimately what he says, okay? So I am concerned that his research may overstate the benefit. The other thing I can tell you based on his earlier research and my own use of dapsone is a hard drug for people to tolerate. Horowitz previously has published a study about dapsone where he had people work up to taking 100 milligrams. And in that study, if you read it carefully, he shows that approximately, I think it's around 40%, somewhere in that range, 40 to 45%, had to stop taking it because they couldn't handle the drug. That was a study where he was only trying to get them up to 100 milligrams, okay? And in that study where he was just getting them up to 100 milligrams a day, although a lot of people did have benefits, when you break down the benefits that they had, the range of improvement was about 10 to 15%. It was actually not the huge benefits that he was promoting at that time. So do I think it's something that we can use to treat persister Lyme? Yeah, I do it with my patients. But I will tell you my experience is that most people, we barely can get over 100 milligrams. And that even at 100 milligrams, there are some people that do get good benefits. It is a treatment I'm using, but I find it to even be a harder drug than disulfiram for the average person, to be quite honest with you. And the study of 40 is an extremely limited study done by an author that is extremely enthusiastic about what he has found. And so you have to be concerned about whether this is something that we could repeat in other practices. And my own experience is probably not. Is it something I still use? Yeah, I think it is something that if disulfiram doesn't work and disulfiram with antibiotics that treat growing forms of Lyme doesn't work. Would I look at doing a dapsone regimen? Yeah. I don't know that the average person is going to be able to get up to 200 milligrams. It's a really hard drug to use. Okay. All right. Thanks for that question. Good luck to you. Mizzy, thank you for your blessings comment here. I appreciate that. Thank you. Hello, Lynn. Let's see. I'm in a number of herbal formulas, some of which may have antibacterial properties. One is knotweed, biocidin, a small amount of cat's claw, cordyceps, ashwagandha, astragalus, kelp. Could the antibacterial herbs be driving the Lyme Bartonella to stay in the persister state? And if so, how long can the persisters wait it out? So once persisters form, we have no studies in humans that tell us how long they last. We do have some laboratory experiments that have been done. The main one that gives us maybe some idea that at least that was published was by Dr. Ken Lewis's lab at Northeastern University. I think it's coming up on 5 or 6 years ago. And Dr. Lewis is the first doctor to prescribe, to have discovered, or at least to published research showing that Lyme can develop persisters. And in his research, what he did is he took Lyme germs in the lab, exposed them to, I believe it was ceftriaxone and doxycycline he used in that experiment, and then waited for persisters to show up. And then he would stop antibiotics. And once the germs woke up by looking at them under the microscope, he would then introduce antibiotics again. And in his study, he showed that by starting and stopping that way 4 times, you could wipe them out. Clinically, starting and stopping 4 times usually doesn't work. But in a lab experiment, it does. So keep in mind, in a lab, things go differently in a lab than they do in a human being. Okay? All right. Now, I cannot remember from his experiments if he wrote about the length of time it took for these germs to come out of their persister state in a lab after the antibiotics were stopped. I don't know. But that could give us some evidence. But the truth is, in a living human, once they've been triggered, we don't know how long they last, okay? In terms of whether biocidin and cat's claw, so your germ killers here would be, knotweed has a little bit of germ killing. It's more of an anti-cytokine, actually. Biocidin, the various herbs that are in biocidin, one of them is rosemary, and rosemary is shown to actually treat persisters. So probably biocidin might be taking care of the persisters, but we have no evidence from research being done on biocidin and persisters to show if it can. In theory, it might, okay? Cat's claw and is the only other antibacterial here. No one that I have seen has done any research showing whether cat's claw is something that treats persisters or not. No one's done that research. It may trigger persisters, but to be honest, I don't know. I have no idea. Okay. All right. So that's what I know. Okay. All right. Thanks, Lynn. Hello, John. Hi, Dr. Ross. Would a Lyme or co-infection make the immature granulocyte white blood cell elevate? Thank you. To be honest, I don't know. I haven't paid attention to that in my studies to know that it isn't something I followed with the research on that either. I do periodically see some of my patients that will have that, but it's unclear to me as to what the cause of that is. Okay. All right. Thanks, John. Hi, Dr. Ross. What do you think of target factors for advanced Lyme? Do the general ones work, or do you need the targeted ones? So I think what you're referring to, the factors, I think you're talking about transfer factors, okay? So let's just talk briefly about transfer factors. So transfer factors are proteins that are made by the detective side of the immune system, the detectives, those things that see infection, okay? And the detectives don't fight the battle. But what they do is they release these things called transfer factors that effectively target the germs. So the germ killing part of the immune system will come in and get them. Okay, you can kind of look at it that way. So each germ that is in us, it is potential that the immune system has the ability to develop a targeted transfer factor for that specific germ. So for instance, there are targeted transfer factors against Lyme. There can be targeted transfer factors our immune system makes against the cold virus. There can be targeted transfer factors our immune system makes against coronavirus, okay? All right, so Research Nutritionals has a product out there called Transfer Factor Lyme Plus, and that Transfer Factor Lyme Plus has targeted transfer factors in it against Lyme, Lyme, Bartonella, Babesia, Ehrlichia, Anaplasma, Chlamydia pneumoniae, I believe HHV6, and I believe Epstein-Barr virus as well too. I think it's against those things, okay? I think on my product page, I mentioned that. On my transfer factors article, I actually mentioned for sure what it does. But off my top of my head, I think those are the things it targets. All right, so that would be good to take. A general transfer factor mix, like the transfer factor multi-immune by Research Nutritionals, is designed to turn on natural killer cells, which are just one type of immune cell that fights all kinds of infections, including Lyme, but it doesn't necessarily target it to get to the Lyme. So I sometimes let people do both. All right. If you want to do just the targeted approach, that would be transfer factor L plus is their product that targets those 8 germs, including Lyme, Bartonella, Babesia, Ehrlichia, et cetera. Okay. And you would do 1 pill twice a day on that. And then the way I use the transfer factor multi-immune is 1 pill twice a day on that too. Okay. So for those of you that didn't know what I was talking about or want to read more information, let me just do a quick screen share here. All right, so let's see here. So I do have a whole article on transfer factors and where I describe each of the individual products too. You're going to find that in my immune system chapter. I think you're going to find it in my immune system chapter. Well, it should be in my immune system chapter. Let me see where I put it. Hold on here a minute. There it is. Okay. So this is so just type in transfer factors. It's called Transfer Factors Turn on the Army. And it's where I break down the individual products. Here I describe the transfer factor L+, transfer factor plasmic, which is for viruses, transfer factor enviro, which is transfer factors that work against mold toxins, okay? And I tell you how to take them here, okay? All right. Looks like I got to go back and re-tag that article so it shows up in the immune system chapter. That'll be one of the things I'll do later this evening, I'm afraid. All right. Thank you for that question. Good luck to you. Hello, Lotta. Let's see. Loda, maybe. I'm not sure. I'm not sure how you spell that or say that. But anyhow, hello, or pronounce that, I should say. Thank you so much for doing this. Your help is absolutely wonderful. You're welcome. My question is, last year I took disulfiram for around 3 months and felt a lot better. Unfortunately, I got terrible pain at the soles of my feet and ended the treatment. The pain is still there 1 year later. What should I do now? I was thinking I might be Bartonella causing the pain. Can I treat Bartonella before treating Babesia? I appreciate all your help so much. Okay. So to see if it's Bartonella, let me give you a few comments. Okay, number one, so pain on the soles of the feet is a symptom that we do see in Bartonella, but not all pain on the soles of the feet is caused by Bartonella. All right, so there can be other causes. Okay, so in terms of whether you have Bartonella, I would take a look at the article I have on how do you diagnose Bartonella, focus on Bartonella symptoms. And in that article, I list out a whole host of symptoms, including things like anxiety, feeling like you're vibrating, scratch mark rashes, etc. But if you have a number of the symptoms, then it might be fair to say this is Bartonella. And yes, it is okay to treat Bartonella before Babesia. Okay, all right. But the other thing you have to consider is, did you get neurologic injury from being on the disulfiram? So disulfiram has some side effect issues, okay? One of the biggest ones is it can lead to liver inflammation. So that's why we do regular blood testing when you're on it. About 30% of people that are on disulfiram develop mental health problems. Those will go away when you stop it. About 15% of people develop neurologic injury on disulfiram. And we used to think, I thought it would always go away, but it doesn't. There's a small percentage of people I'm finding in my practice, maybe 1 or 2%, that if they get neurologic injury, it doesn't go away easily. Okay, so this also could be neurologic injury. And so the treatment approach I do for that would be to do mitochondria repair with that ATP 360 I mentioned earlier tonight. And I also would use some glutathione. The ATP 360 is 3 pills 1 time a day. And the glutathione would be the Trifortify product by Research Nutritionals. And I would do 1 teaspoon or 5 milliliters 1 time a day of that. Okay. There's a whole article I have about how do you do nerve repair. So if you want to read more about this, I just kind of went through that quickly. Let me do that, a screen share, and show that to you here real quick. All right, let's see here. So take a look in the brain and nerves section and look at my article about how to heal your nerve injury. Okay, this one right here. All right. All right. So listen, everyone, that's it. I've got 2 Basenjis that need to be walked. I've got me that needs to be exercised. And I got to feed myself eventually. So anyhow, I got to go home. It's been fun being with you here again tonight. I actually enjoyed doing these. I will be with you again next week. Tomorrow morning, when you hope by around 9, at least by 9:30 a.m. my time here in Seattle, I will get an email out to you that will have the announce that the video is ready to go to be watched. It'll also have a sign up link to sign up for next week's webinar. Okay. All right. For those of you that are still here, the thing I would still, that I hope you do for me, I'm trying to help as many people as possible. And the only way I get to help people is if they know we're here. So if you have people you know that might benefit either from the webinar recording tomorrow or participating in these webinars, please spread the word. When I send out emails to you announcing these webinars, or when I send out email announcing the recording, forward them to as many people as you think might get benefit. Okay. All right. I'd appreciate that. If you would help me, and I'll keep helping you. Okay. Thank you. Good night, everyone. And look forward to seeing you next week. Bye-bye.